Hello, Professor Matthews. My name is Kachi Lo, but I usually go by Tiffany. I will be doing my presentation on dissociative identity disorder, or DID. Um, DID is a disorder where an individual has two or more personalities. I will be diagnosing the character Kevin Wendell Crumb from the movie Split. I'm pretty sure you've seen that before. In this movie, there are so many scenes that prove that he has DID, but we will only be talking about a few of those examples. The first example would be when Kevin is talking to his therapist, and he explains that he has different personalities in him, that these alternate personalities in his mind take control of him, and Kevin refers to them or refers to this as being in the light. So, whichever personality is controlling Kevin at the time would be considered in the light. Um, and this proves that he has different personalities that can control him at any time, which is a symptom of DID, of course. The second example would be when Kevin experiences flashbacks of his early childhood where his father abandoned him at a train station, which left him with his physically abusive, and compulsive mother who would regularly beat him for the smallest things, such as not keeping the house clean enough, and he would get a whipping or just punched and kicked. Um, and individuals who suffer from DID usually have some sort of childhood trauma, and generally early um, trauma in their life where that personality can split. These traumatic events can cause their core personality to fade away to release an alternative personality who can then assert a more protective personality, in a sense, as a sort of mental defense mechanism. That brings me to my next example. One of Kevin's personalities were developed due to his mother's short tempered, abusive behavior and OCDness. The personality's name is Dennis. Dennis, in a way, represents his mother. Dennis was somewhat created by Kevin as a defense mechanism to deal with his mother. So that can be the cause of that personality to appear. In the last example, would be when Kevin is taken over by the 24th personality. And he snaps back into being Kevin. Kevin did not know how he got there, and he did not know what year it was. This is a common sign of DID. It is common for individuals to experience a loss of time, wake up and have no idea where they are or have been, or what their personalities have said or done. This is very common. Like I said, these are some of the many indications that Kevin Wendell Crumb has DID, bad DID at that. There are there is treatments that are available, but the one that works best is called psychotherapy, which is also considered talk therapy. And in this psychotherapy, there are three stages. The first stage basically focuses on stabilization and safety of the individual who is suffering from DID. The person and their therapist will work on reducing behaviors that are suicidal or self destructive. A lot of these patients who have DID, they are suicidal because, of course, can you imagine dealing with that kind of behavior? I mean, I honestly couldn't even imagine it. So I can imagine that being very frustrating for that individual. But basically, the therapist can help the individual combat these behaviors by learning healthy ways to cope with negative thoughts. Some ways would be through emotional regulation tools and relaxation techniques. Individuals learn that being able to tolerate one's emotions is very important to on their way to recovery. This stage also helps individuals develop healthy habits and routines, such as getting enough sleep and rest, which is a small thing but very important. Um, and stage two is where they pretty much concentrate on individuals carefully and gradually process their traumatic memories as a child, or just any traumatic memory. They will discuss which memories will be addressed, which interventions will be used, which identities will be participating. It's kind of funny. Um, now, how safely um, it will be maintained, and what to do if sessions become too intense. So all that is already thought out. This allows the patient to realize that the traumatic experiences belong to the past and to understand the impact in his or her life, which is very important to stage two. And then here at stage three, individuals will learn how to reconnect to themselves and others and refocus their life goals. During this stage, people will achieve a more concrete sense of themselves, ultimately combining their alternative identities into one, which is the goal. But of course, stress and things like that can flare up DID. And usually, as you know, stress is what causes DID at an early childhood, so that would make sense. Um, so there are no as of now, there are no medications for treating DID. The only medications prescribed are treating the symptoms of the disorder, such as mood and anxiety symptoms. Doctors might prescribe, antidepressants like serotonin reuptake inhibitors is a thing, but there is no medication that helps with DID itself. So the best therapy is the psycho therapy, which is the talk therapy. And that, of course, is what I would choose in order to treat my patient. And yeah, I think that is it. And I had a really fun time learning about dissociative identity disorder. I think it's really interesting, and I really enjoyed this presentation. Thanks for watching. You have a great day, and just thanks for the semester and dealing with all this bullcrap. Okay, bye, Mr. Matthews.